final question is a home video from Josh in Austin, Texas.
Hi doctors, I have a question for you. I am a big lover of tattoo. I wanted something that stood for who I am as a person, so I chose an Asian kanji symbol that stands for bold. But there was actually a little bit of a mishap at the tattoo shop. They gave me an Asian kanji symbol that means rotten. So, my question to you is, what are my options for removing this unwanted tattoo?
Coming up, Josh is here, and we're heading inside the procedure room to remove his tattoo in real time with a powerful new laser. You won't believe the results. Before the break, we met Josh, who is desperate to get rid of his ankle tattoo. Josh is backstage right now in our procedure room with Dr. Orton and dermatologist Dr. Will Kirby. So, Dr. Orton, what are we going to do for Josh?
Remove his tattoo here today with the newest, latest in tattoo removal. Dr. Kirby, tell us what we're going to do here.
The process is actually relatively complex, but we keep it simple. It's an MD YAG quality switch laser. We're going to fragment the ink and let Josh's body absorb it on its own.
So, Dr. Kirby, Josh understands it's going to take more than one treatment to get the end result, but we have some before and after pictures that you can show us, go over, of what he can expect after multiple treatments in a few months.
That's correct. Your body naturally absorbs the pigment and it breaks it down the same way it would with any foreign particle. In a tattoo that's untreated, the pigment is really thick and it's sort of coalesced, but your body breaks it down, we fractionate it, we sort of help your body do what it wants to do on its own.
Very nice result.
Thank you very much, and I think Josh is going to get a very similar result. Pale skin, dark black ink. He's going to be really pleased in just a few weeks.
Awesome. That's what he wanted to hear.
Exactly.
Absolutely.
Okay, great. And Josh, are you ready?
Absolutely. I mean, I've had this mistake of a tattoo that means rotten.
So tell us exactly how that worked.
Well, one night after a little too much to drink, I decided to get a tattoo, and unfortunately for me, there was a little bit of a mistake at the tattoo shop, and instead of getting a tattoo that meant bold, I got one that meant rotten.
How did you figure that out? How did you figure out that it was rotten?
It was actually about 5 days later. I was talking to someone that is actually really familiar with Chinese these symbols, and they told me that this doesn't mean bold, it means rotten. And so I think it's time to remove the tattoo.
So you're ready. I think
I've been ready for a very long time.
He doesn't want to be rotten anymore.
I should preface this by saying most patients like to numb up. Josh has a really high threshold for pain, so move forward with no numbing.
Absolutely
and
not.
Going into it. Let's throw our glasses on.
Okay.
Nurse Sarah, we set with the laser? Okay, Josh.
And this is the Q switch laser.
Quality switch. What I'm going to do is I'm going to start treating the bottom. We'll stop for a second and talk to you and see how you're tolerating it, okay? So on 3, I'm going to get started. You ready?
Absolutely.
1, 2, 3.
There you go.
Beautiful.
It's actually not bad.
That's pain pretty well.
That's sucking that up pretty good, isn't it?
It's disappearing.
And there's certain color lasers that respond better, correct?
Actually, black is the ideal color to treat, and Josh is really pale, so he's a great candidate. You can clearly see the great result he's getting here. Earlier in the show, you guys showed some before and afters. Sometimes a little bit difficult to discern. Right here, you can't deny it.
That's how the laser works. It targets the color, the pigment, in the skin itself.
Absolutely. It's a process called selective photothermolysis. I know you're thinking nerd alert. You're probably right. I'm a little nerdy, but it goes in and destroys a specific chromophore. And I'm really pleased with the result he's getting. How are you doing? You feel okay?
How many treatments does this take typically?
It takes multiple treatments to remove the ink completely. You need, in my approximation, approximately 7, and we want to space them about 6 weeks apart.
Perfect.
You ready to finish it up?
Absolutely. It's really actually not
That's looking
bad
pretty
at all.
good.
I'm really impressed. Here we go. 1, 2, 3.
I can tell too. Looking good.
3 seconds left. 4, 3, 2. We're all done, Josh.
Easy.
So, needless to say, with just one treatment, you see some significant reduction. I hear some clapping. Thank you very much. And I'm really pleased overall. We'll address that for you, treat it for you, and I'm also going to continue treating you for free at my office.
Well, gentlemen, thank you so much. Dr. Kirby, we appreciate it. Good luck to you, Josh.